Leukemia is a cancer of the blood. This cancer starts in the bone marrow, which is the thick, spongy liquid inside your bones. When a person has leukemia, the body makes too many non-working blood cells of one type. These abnormal cells are most often white blood cells and don't work as they should. They also crowd the bone marrow so it can't make other blood cells, often red blood cells and platelets. This leads to low red cell count and cause anemia, increased bleeding due to low platelets, and increased infections due to abnormal white blood cells. Leukemia is grouped by how fast it develops and gets worse, and by which type of blood cell is involved. The first group, how fast it develops, is divided into acute and chronic leukemia. Acute leukemias grow fast and get worse very quickly. Chronic leukemias tend to be slow-growing, but may get worse over time. In people with acute leukemia, the diseased bone marrow produces an excessive number of abnormal blast cells. These cells accumulate in the bone marrow, interfering with the production of normal blood cells. Acute leukemia develops and progresses quickly and therefore needs to be treated as soon as it is diagnosed. In chronic leukemia, there is an accumulation of mature but abnormal white blood cells that have undergone a malignant change when developing from a blast cell. Chronic leukemia progresses more slowly than acute leukemia and may not require treatment for a long time after it is diagnosed. The second group, what type of cell is involved, is divided into lymphocytic and myelogenous leukemia. Lymphocytic leukemia involves bone marrow cells that become lymphocytes. Myelogenous or myeloid leukemia involves the marrow cells that create red blood cells, platelets, and other kinds of white blood cells except lymphocytes. There are four main types of leukemia. Acute lymphocytic leukemia is the most common form of childhood leukemia. It can spread to your lymph nodes and central nervous system. Acute myelogenous leukemia, or AML, is the second most common form of childhood leukemia and one of the most common forms for adults. Chronic lymphocytic leukemia, or CLL, is the other most common form of adult leukemia. Some kinds of CLL will be stable for years and won't need treatment, but with others, your body isn't able to create normal blood cells and you'll need treatment. Chronic myelogenous leukemia, or CML, may not have noticeable symptoms. People of age 65 and older have a higher risk of this type. Complete blood count is the basic laboratory test to screen for leukemia. If a person has positive indications, several tests such as bone marrow biopsy, chest X-ray, and CT scan can be done to confirm a diagnosis of leukemia. Hope you learned some valuable facts about leukemia. Subscribe for more amazing learning videos like this. Thanks for watching.